Bismillahirrahmanirrahim. Today we will be doing Gynae Obs Feb 22 2023 morning paper. The first MCQ is a lady with postmenopausal osteoporosis with history of breast carcinoma in family. Which drug should be given? So it is SERM. The next is a patient presented with painful right big toe. He was diagnosed to have gout and the doctor advised allopurinol. Which factor will affect the availability of allopurinol? So it is albumin. Infectious mononucleosis is caused by Burkitt's lymphoma, Epstein-Barr virus. Mm, which of the following will prove this its association? So it is Epstein-Barr virus genome common in African people. Female was diagnosed with pulmonary TB and she has been taking oral contraceptive pills for 2 years. She had suddenly started vomiting and now her beta HCG is positive. Which of the following drug caused OCP failure? So it is rifampicin. Basal ganglia send excitatory output in medullary reticular system. Levels of LH peak how many hours before ovulation? So it is 24 hours. Regarding two trial test B, equal chances of rejection on both the sides. Clear? Porphyrins attached to which plasma protein? So it is attached to albumin. Content most likely to be seen in inguinal canal of a female is round ligament and ilioinguinal nerves. In males, it is spermatic cord, while in females, round ligament and ilioinguinal nerves. COVID-19 recently shows a specific transfer which is named as SARS-CoV-2. Nerve supply of rectus abdominis is lower 6 thoracic nerves. Rectus abdominis is supplied by lower thick 6 thoracic nerves. Transversus abdominis, lower 6 thoracic and iliohypogastric and ilioinguinal nerves. L1. Female had previous missed abortion. ठीक है. Now which assays can be used for confirming pregnancy and HCG in urine? So it is enzyme like immunoassays. Which location of compact bone? What is the location of compact bone? तो it is directly under the periosteum. ठीक है, आप याद रखें कि ये जो periosteum है, it is located in diaphysis of long bones and under the periosteum. When carbon dioxide transferred to lungs from the tissues, what happens? So it is acidosis of red blood cells. Infectivity of Streptococcus pneumoniae is due to streptolysin and cell wall of gram positive causes which cause shock, septic shock. Which component of the cell will cause shock? So it is peptidoglycan. After hyposectomy, which cells will be affected? Follicular cells in the thyroid gland. Maximum number of beta cells of islet of Langerhans are present in the tail of pancreas. Central and the neural ridge arch in the vertebrae are joined by pedicle. Condensed lens is in light microscope. इसका क्या फंक्शन होता है? Concentrate line onto the light cone into the specimen. Sparse pubic hair in which stage? So it is stage 2 of puberty. Rapid sequence intubation has to be done in a pregnant female. Which drug crosses placenta and it affects the fetus? So it is V. curium. Location of brachiocephalic vein is just behind the sternal end of clavicle. Regarding zona fasciculata of the adrenal glands, ACTH act to produce cortisol. Deep inguinal ring is formed by which of the following? So it is transversalis fascia. Deep inguinal ring, transversalis fascia, superficial external oblique muscle. Sedimentation of erythrocyte increase by decrease in albumin. A lady with chronic renal failure present sample taken which was placed in refrigerator overnight. ठीक है, overnight refrigerator में रखेंगे तो obviously ये क्या हो जाएगा? blood sample जो है वो hemolyze हो जाएगा. A child presented with recurrent rhinitis, urticaria, rash on upper lower limb. What is the cause? So it is hypersensitivity reaction type 1. Effect of hypernatremia on the body is सेल श्रिंकेज. हाइपरनेट्रीमिया में क्या हो जाएगा हमारे पास? सेल श्रिंकेज हो जाएगी. ठीक है, उसमें होता क्या कि एक्स्ट्रावाइजेशन ऑफ फ्लूइड फ्रॉम द सेल इनटू द एक्स्ट्रा सेल्यूलर fluid. An 18 years old girl presented with primary amenorrhea, short stature, shield chest, and wide carrying angle. What is the diagnosis? So it is Turner syndrome. Pregnant female had decreased levels of T3 and T4 and increased TSH lymphocytes are also found. It is related to Hashimoto's thyroiditis. Hashimoto is the common cause of hypothyroidism and it has healthy cells and lymphoid aggregations with germinal centers in it. The next is similarity between the cardiac and the skeletal muscle is both have transverse striations in them. Common feature between the smooth muscle and the skeletal muscle is increased intracellular calcium before contraction. Common feature between the cardiac and the skeletal muscles is transverse striation. Difference between the skeletal and the smooth muscle: calcium calmodulin complex in smooth muscles. Striated muscles that rhythmically myogenically contract in a synchronized fashion as cardiac muscle. Heart work as a sensation because of its gap junctions. Histology of a slide shows serous acini in connective tissue and duct. This is related to salivary glands. Tubular structure with small lumen and transitional epithelium of 3 layers. स्मूथ मसल्स, तो ये हमारे पास क्या है, यूरेटर्स हैं, ठीक है. यूरेटर हैज़ 3 layers, ठीक है. ट्यूनिका, म्यूकोजा, ट्रांजिशनल एपिथेलियम एंड द कनेक्टिव टिश्यू. क्लियर? Okay, the next is group of neurons that generate the basal rhythm for breathing includes dorsal, ठीक है, dorsal और neurons. लेंथ ऑफ द लेफ्ट ब्रोंकाई इज, तो ये हमारे पास लेफ्ट वाला 1 सेंटीमीटर, ठीक है. राइट ब्रोंकस 2.5 सेंटीमीटर और फिर लेफ्ट वाला 5 सेंटीमीटर. सॉरी, ये जो लेफ्ट है ये हमारे पास 5 सेंटीमीटर का है, ठीक है. Okay, the next is in hanging, sudden death occurs due to fracture of odontoid process of axis. Non-diabetic female underwent cholecystectomy, presented on 4th of day with cough, hemoptysis and dyspnea. What is the cause? So it is pulmonary embolism. All female fall in washroom led to fracture and replaced by prosthesis. The following day she developed dyspnea and petechial rash on the skin. Which one of the following is the cause? तो it is fat embolism, ठीक है. ये क्या है हमारे पास, बोन का फ्रैक्चर है. आफ्टर हेमरेज व्हाट इज़ द इमीडिएट मैकेनिज्म टू स्टॉप ब्लीड? तो इट इज़ वेजल्स वेजोकंस्ट्रिक्शन, ठीक है. आफ्टर इमीडिएट जो मैकेनिज्म होता है क्या, वेजोकंस्ट्रिक्शन होती है. आप पेशेंट ऑफ टीबी is on anti-tuberculosis drugs for 2 months. TB antibodies is characterized by these are bound to cell bound antibodies. Complete transaction of brain above the pons will result in prevent any voluntary holding of breathing, ठीक है. इसकी explanation देखिएगा. cerebral cortex control voluntary control of breathing. If lesion above the pons, it means that the cerebral cortex which is above the pons is resected and there will be no voluntary control of breathing anymore. A patient presented with abdominal pain. His serum amylase was raised, ठीक है. What type of necrosis is seen is mesentery of this patient. तो ये हमारे पास mesentery में कौन सा होता है, fat necrosis होता है. Kaplan-Meier's curves indicate survival of patients. 90% of the cases of anthrax which lesion is found, तो इस anthrax में skin lesions found होती हैं. Okay, in cell membranes bound between internal protein and the lipid is hydrophobic and covalent bond. Receptors for the growth hormones are present in which part? तो growth hormone के on the plasma membrane, ठीक है. Okay, ribosomes composition is, so ribosomes are composed of RNA and proteins. A patient has anemia and hypersegmented nuclei. It is due to deficiency of folate, ठीक है. hypersegmented nuclei हैं. How is iron deficiency in serum check? तो उसके लिए हम क्या करवाते हैं, सीरम फेरेटिन करवाते हैं, ठीक है. अब इसको देखिएगा, वी हैव 2 different points, ठीक है. कहीं पे सीरम आयरन की डेफिशिएंसी सीरम में हम लोग सीरम फेरेटिन और टीआईबीसी से चेक करते हैं, ये लिखा हुआ है. और कहीं पे की लिखा हुआ है सीरम फेरेटिन, लेकिन आयरन डेफिशिएंसी के लिए हम लोग सीरम फेरेटिन ही करवाते हैं.
मैं सब माऊ को लेके जाए?
ज़रूर.
क्यों?
फिर उसको घर छोड़ के जाओगी?
उसके लिए केक ले